Today on Dependency TV, we continue the topic of drug treatment with someone who has been a client and is now a counselor with the leading facility in the country.
We will also hear an authentic account of what drug treatment is like and learn about the benefits of a structured approach to recovery.
I am Paul McLetchie. I'm a recovering addict for the past 21 years, clean and sober from all drugs. My first encounter with drug treatments is when I went to Life Ministries up on the Mount, and I realized it was the ideal place for me because it dealt with not only my drug using, but it also dealt with my low self-esteem, my ability to communicate effectively with people. It dealt with my physical ability to improve myself because as a result of using drugs, my physical body was impaired. I became drawn and skinny, I lose a lot of weight, and was able to, I wasn't healthy, so to speak. So that was my first encounter with New Life Ministries. I remember the night before I had a dream, and I dreamt that I'm going to a real green place. And when I went there for the first time, I felt this was the place for me because it was absolutely wonderful and amazing.
Even though there are many dangerous drugs available out there, crack cocaine is still accessible and sought after by many users, despite its harmful effects. The abuse of this substance often leads to jail, institution, or death, not necessarily in that order. Or it can turn you into a street dweller. It can be used in many ways: smoked, in black cigarettes, piped, in a Zush bottle, or other device, freebased, or injected. Most users get hooked from the first hit, which progresses to frequent use, dependence, and addiction. Most users will spend an entire salary on the drug while neglecting the needs of family, ignoring commitments like paying monthly bills, etc. This can eventually progress to selling of possessions, neglecting personal hygiene, committing crimes like petty theft, armed robberies, all in search of that first euphoric feeling.
My treatment in drug addiction at the center was what I expected. However, I got even more in the sense that I went there to stop using drugs, but I realized that addiction involved much more than using drugs. It involves the hollow space within me that needed to be filled. You see, I came from a background where I had low self-worth, and as a result of having low self-worth, I thought I could have filled it with things, and one of them was drugs. So when I entered treatment, I realized staying away from the drugs was just part of the problem. The other part was rebuilding me from the inside out, which entails learning how to communicate, learning how to value myself, learning how to build myself as a productive, conscious being. These are some of the tools I got from the center, which I never knew existed and which I totally did not have. So as a result of going into treatment, I realized that, hey, I'm a better person. I could communicate better with my family. I could talk about my feelings. I could learn to manage stress. You know, managing stress was a big thing for me because that was a trigger for my drug use. When I'm happy, I'm using drugs. When I'm sad, when I'm depressed. So now, if I could live a life with the tools to manage stress, to feel good about myself, to communicate, then I have a balanced being that feels good about self. So I don't need to run to an artificial feeling and energy which totally destroys me. Family support is absolutely absolutely important, because we know for a fact that addiction not only affects the individual, it affects the family. And sometimes family may be enabling a person to continue to use without realizing it. So by attending these sessions, my family were able to understand the nature of addiction and understand that I wasn't a bad person, but I was somebody who was sick and needed help, that I was suffering from a disease called addiction, which makes one totally self-centered. Once a person is addicted to a substance, they become totally self-centered, meaning that the relationship with their family is totally impaired. So they don't really care about their family, they care about themselves. And with that causes a lot of hurt and pain on the family. So my family support started to realize some of the things I was doing, not because I was bad, but because I was powerless and that I needed help. And now that I got the help, they knew now how to interact with me better than they were reacting before.
Actually, it's scientifically sound, and we've known how viruses have been transmitted for a long time. So it's applying these same principles to COVID-19, the pandemic, to protect ourselves. And if we follow these basic guidelines, then it radically reduces the ability of one person to pass the virus on to another. We also know, for example, though, that for health workers, they should have special masks. So, for example, they use N95 masks, which filter out 95% of the virus that can reach their respiratory system. So we know quite a lot about how viruses are transmitted. So it's based on science. It's not trying to create inconvenience. It is trying to save lives.
What are the short-term effects of crack cocaine? Crack cocaine causes a short-lived, intense high that is immediately followed by the opposite, intense depression, edginess, and a craving for more of the drug. People who use it often don't eat or sleep properly. They can experience greatly increased heart rate, muscle spasms, and convulsions. The drug can make people feel paranoid, angry, hostile, and anxious, even when they are not high. Regardless of how much of the drug is used or how frequently, crack cocaine increases the risk that the user will experience a heart attack, stroke, seizure, or respiratory failure, any of which can result in sudden death. Smoking crack further presents a series of health risks. Crack is often mixed with other substances that create toxic fumes when burned. As crack smoke does not remain potent for long, crack pipes are generally very short. This often causes cracked and blistered lips, known as crack lip. from users having a very hot pipe pressed against their lips.
One of the things families should know about drug treatment, that it's not a 5-star hotel and it's not a prison. It's not a 5-star hotel and says you will not be treated as if you're a king or a queen. And it's not a prison in that there's no cells, there's no cages, people are free to come and go as they please, and that they're given holistic care. There are nurses round the clock taking care of the clients, their physical needs are met, they get 3 proper square meals per day. They also we have a certified gym instructor called Mr. Leroy Pierre. He attends to their physical being, because in the initial stages when a client comes into the center, they need to go through a detox period, and those exercise in the beginning of the program, not strenuous exercise, are extremely vital for somebody who is in early recovery, as well as what family members need to do. We see addiction as a family disease, so they will be incorporated in the program. So clients will be getting sessions, psychotherapy sessions where they attend group, where they attend communication, and family members come one each fortnight to a family session where they will be growing with the client as well. Because remember, addiction affects the family and family are damaged as well. So we need to mend that relationship in a healthy way.
We're now closer than ever before. Yet it took social distancing to get us there. We're now more aware of how interconnected we all are. Yet it took a virus to teach us what was always obvious. We're more health conscious of ourselves and the environment than ever. Yet it took a global pandemic to create such consciousness. We're wiser now about the planet we share together, yet we just can't afford another lesson on how we need to live this life better. One way, one world. Live easy with Guardian Group.
Now, what are the long-term effects of crack cocaine use? In addition to the usual risks associated with cocaine use, crack users may experience severe respiratory problems, including coughing, shortness of breath, lung damage, and bleeding. Long-term effects from use of crack cocaine include severe damage to the heart, liver, and kidneys. Users are more likely to have infectious diseases. Continued daily use causes sleep deprivation and loss of appetite, resulting in malnutrition. Smoking crack cocaine also can cause aggressive and paranoid behavior. As crack cocaine interferes with the way the brain processes chemicals, one needs more and more of the drug just to feel normal. Those who become addicted to crack cocaine lose interest in other areas of life. Coming down from the drug causes severe depression, which becomes deeper and deeper after each use. This can get so severe that a person will do almost anything to get the drug, even commit murder. And if he or she can't get crack cocaine, the depression can get so intense it can drive the addict to suicide.
Enjoy Simply More with a Digicel Prime Bundle. More data to listen more with D-Music. Watch more with PlayGo. Cheer more with SportsMax. Tune in more with Go Loud. Get 25 gigs plus dedicated LTE data for apps for 30 days for only $249. Dial *323# or visit the My Digicel app to buy. Digicel, better together.
One of the most rewarding aspects of drug treatment is when I left the center and I became clean and sober and I was in recovery. It may sound weird, but to see my mother smile, to see her smile on her face lighten up, and that she was no longer looking worn and tired and haggard as a result of my drug using, that was an extremely wonderful gift for me. Another gift for me is to be able to wake up Friday morning, Saturday morning, and go to work, go and sweat, go and play basketball, go and swim without having a hangover, without worrying about who money I borrow, who people I owe, without having to explain to people, why are you looking so thin? How are you losing so much weight? The peace and the serenity that came with recovery was one of the most valuable things. In terms of gratitude, I acquired a taste of gratitude. I was somebody who was never contented with what I have. But since I entered treatment, I was grateful for the little things. Because recovery, as I grown to understand, is not what I've lost. I've lost a lot of money. I lost some relationships, but it's gaining the things I never had. I never had an attitude of gratitude. My mother would work hard to buy stuff for me, and I always found that was never enough. My father will give me things I would find that's never enough. But when I came into recovery, I developed an attitude of gratitude. I'm grateful for being alive. I'm grateful for the smile of my mother. I'm grateful that I could talk clean and sober. I'm grateful that I could look people in the face and look at them and talk to them. I no longer have to judge and look away because I know I did something wrong. So that attitude of gratitude is another gift I've gotten in treatment that I'm really grateful for. What I would like to say to the addict out there and their family who are still suffering, that once there's life, there's hope. Once the person is breathing and living, there is hope, because addiction is not a death sentence. People do recover from active addiction. There is hope. There is new Life Ministries out there that they could call and make an appointment for them to get help. Even if your family member don't want help, there are people who could come to their home and do an intervention and talk to them and journey with them, because we believe that no addict have to suffer. There is hope and there is a choice. Because look at me. At one time I was deemed hopeless, penniless, and no hope at all. Today I'm clean and sober, living a clean and sober life with a healthy family, healthy relationships, and loving every minute of it. So what I have to say to the addict and the family out there is hope. There is life after using drugs.
Some of us like to play games of chance, but remember, gaming should be fun, so don't get carried away. Play for a prize, but don't pay the price. Play for fun, but never for keeps. Play smart, but never play all. Winning isn't everything. If you or someone you know needs help, call our gambling addiction hotlines. Rebirth House 24-hour hotline 466-3146 or Serenity Place Empowerment Center for Women 794-7980. An initiative of NLCB and Eye on Dependency.
I am Paul McLetchie, an addiction counselor at New Life Ministries for the past 19 years. How effective is residential treatment opposed to self-help outpatient treatment? I would say residential treatment is extremely important, and that there are people who need residential treatment in terms of the nature of the drug they're using, in terms of how chronic they are, in terms of an addict. That is extremely important, because what we know for a fact is that some people they cross the imaginary line of social use. They're in chronic stage. So every day they will be using drugs, especially if they live in an environment where drugs easily accessible and they are no longer being a productive member of society. We will recommend a residential treatment. However, there are some people who in their active addiction stage are bordering on chronic use. So for example, alcoholics 9 out of 10 times need residential treatment, because when alcoholics come into treatment, they need to detox for a period of time, because what happens with alcoholics, if they don't seek medical help when they're detoxing, they go through withdrawals and they could get DT and die. So when they are at the center, they will be given some drugs prescribed by a doctor that they will take for a period of 14 days, and that will help them cope with the withdrawals. So alcoholics who are chronic users absolutely need residential treatment, because if they try to do it on an outpatient basis and they don't get the medication to administer to themselves regularly, they could get DTs and die. And by DT I mean delirium tremors, in the sense that when the alcohol is withdrawn from the person, the body starts to yearn for it, and the alcoholic will start to shake. And when this happens, if alcohol is not administered, they could get a heart attack, they could get some severe seizures, and they could die as a result. So what happens is that we recommend them to see a doctor, where he will do an evaluation and give them Valium to help them cope with those DTs. So when they're in the rehab, they won't be shaking as much. The Valium will help them to calm them down for a period of time, and after about 14 days, it's withdrawn. They no longer get the Valium, and they're able to continue with their treatment. One of the most rewarding things for me is to see a client come into the center and make that change, make that step towards recovery, make that new way of life for himself. There's nothing as rewarding to that for me. You know, to see a client come in, he was penniless, broken, nothing at all, and then make steps. For example, there was a client who passed through the center. When he came in, he came with a small brown paper bag. That was all he owned. He owned nothing else. His wife had died, and he had a son who was with his wife's family. All he had was a paper bag. And when he left the center, when he went back home, the roof was gone because he sold everything in the house. He didn't have no roof, didn't have any windows. And he lived in a drug-festered area. Today, that same person has 2 houses, remarried, have 3 other children, and is clean and sober over 18 years. That, my friend, is money can't buy the joy I feel to be part parcel of that person's recovery. Closing remarks. I like to say, in terms of this journey of recovery, it is possible, because we human beings have the power to change. No addict have to live life and die using. The power of recovery is a wonderful thing. There are many productive people in our society today who are living clean and sober life, but one has to want it more than anything else. There is a story about a frog in the well. There were 2 frogs living in a well, and one frog jumped out of the well and he saw lakes and rivers and streams and all kind of beautiful surroundings. And he went back to the well to tell the other frog, you know, you need to jump out too. And the other frog stayed in the well because he couldn't believe or perceive in his life there was a life outside the well. So to the addict who is still using out there, we are instructing you to take that leap, make that phone call to New Life Ministries, and come out and see that there is a wonderful, beautiful life without the use of drugs. Thank you.
Because it is smoked, the effects of crack cocaine are more immediate and more intense than that of powdered cocaine. Loss of appetite, increased heart rate, blood pressure, body temperature, increased rate of breathing, dilated pupils, disturbed sleep patterns, nausea, hyperstimulation, bizarre, erratic, sometimes violent behavior, hallucinations, hyperexcitability, irritability, tactile hallucination that creates the illusion of bugs burrowing under the skin, intense euphoria, anxiety and paranoia, depression, intense drug craving, panic and psychosis, convulsions, seizures, and sudden death from high doses, even after one use. Long-term effects: permanent damage to blood vessels of air and brain, high blood pressure, leading to heart attacks, stroke, and death, liver, kidney, and lung damage, severe chest pains, respiratory failure, infectious diseases and abscesses if injected, malnutrition, weight loss, severe tooth decay, auditory and tactile hallucinations, sexual problems, reproductive damage and infertility for both men and women, disorientation, apathy, confused exhaustion, irritability and mood disturbances, increased frequency of risky behavior, delirium or psychosis, severe depression, tolerance and addiction, even after just one use. The answer? Just don't do it.
Drug treatment is an important part of the recovery process, but the addict must want to get better, and the family has to actively participate in the process both during and after the treatment regime.
Join us next time for the final episode of Ion Dependency TV, when we share a special moment with our very own God Sinclair. See you then.